Everybody, this is Dr. Joe Borio with this week's Health Kick. It's a beautiful day. It's Mother's Day. It's Sunday. It's probably about 4:30. I'm out on my back deck here. It's just gorgeous. So nice to get outside after just a long, hard winter, huh? Today I wanted to talk to you a little bit about a topic that I hear so many people suffering from, a couple of people close to me that I know, and that is bronchitis. Bronchitis is a condition I think that is misunderstood. It is improperly handled and treated too often, and if left untreated, properly cared for, people tend to become recurrent in their bronchial infections, bronchial inflammation, and as a result, they end up causing damage to the bronchitis, and they, like I said, become recurrent. They get it over and over and over. It becomes seasonal 2 or 3 times a year, and it's something that can cause permanent damage to the lung, which in turn makes you more prone to having it. Can cause more damage to the lungs. So it's certainly a condition, especially as we age, where the cardiopulmonary system tends to weaken in many people as well. It's certainly something to pay attention to. So what is bronchitis? Well, in your body, in your lungs, in your chest, you have what they call bronchi, which are large, think of like a garden hose. Think of large tubes that then branch out like a tree branch into smaller tubes that go to these little alveoli, which are little bubbles that blood circulates by, and you exchange carbon dioxide and oxygen for. So it's amazing how that system works, right? So the heart pumps blood that's deoxygenated by, and it picks up oxygen, and then it circulates throughout the body. So it's pretty amazing. And in the lining of your bronchi, it's a mucosal membrane. It's like the inside of your mouth. It's red. It's filled with a lot of blood circulation. It makes a lot of mucus. It stays very moist. It's a very smooth. It's actually a very beautiful form of body tissue if you look at it through bronchial scopes and so forth. It's pretty amazing. But in any case, there's little hairs on it as well. There's little hairs, and what they do is they swim in fluid, if you will, and they help cleanse your lung. Your lungs always clean itself from debris and pollutants and things that we breathe into the air. Now, what bronchitis is exactly that. Anytime you see itis really is Latin. It means inflammation of. So if you see arthritis, arth means joint in Latin. Itis means inflammation, so inflammation of the joint. Bronchitis means bronchi and inflammation. The bronchi, the tubes of the lung, are inflamed. It doesn't mean bacterial infection, doesn't even mean viral infection, doesn't mean allergy. It means inflammation of the bronchi. Now, I just tipped my hand here a little bit. The bronchi can be inflamed by many different things. They can be inflamed by viral infections. They can be inflamed by bacterial infections. They can be inflamed by debris, pollutants. Allergies can inflame them. Using your lungs in different temperatures, very hot temperatures, very cold temperatures, can cause inflammation of the bronchi as well. So that's really what bronchitis is. It's an inflammation of the bronchial tissue. Now, when it starts to get inflamed, just like your mouth and mucosal membrane, what's it start to do? It starts to make a bunch of mucus. It tends to swell. So now it's swollen, it's making a bunch of mucus, so it's tougher to get air in and out of your lung. Number 2, the bronchi is inflamed, so it means it's sore. So you get a tightening and a soreness in your chest. Number 3, you're making a bunch of mucus, so now you're making a bunch of yick, if you will, and then that gets down in the lung, and now you're trying to cough that through a tube that's narrowed and sore, and it gives you just an awful chest cold, as many people call it, but an awful chest compression and restriction, and certainly not anything that's comfortable to have. I can tell you that. So those people that get it recurrently, or those people that had it in the past, know exactly what I'm talking about. So how do we help bronchitis? How do we help bronchitis? Well, first off, the best approach is try not to get it. So let's say that we need to keep the lungs clean and healthy, and we need to keep the immune system elevated. How do we do that? All the things that I tell you guys about. You got to drink a lot of water. You got to take proper nutrition. You got to eat well. You got to exercise. You got to sleep well. You got to think positive mental thoughts. All the things. You got to make sure that you're getting adjusted. Those things all help the immune system. So those people that do that on a routine basis are much less likely to get a bronchial infection. On top of that, they're much less likely to have any type of infection for any long term. Number 2, by drinking water, as I said earlier, it allows the body to flush itself, so it allows different pollutants and so forth to get out of the body. Number 3, if you find you're somebody that deals with a lot of allergies, remember those omega-3 oils are really important. Flaxseed oil or fish oil. Those help keep the inflammation down, allow the body to respond a little bit better with the allergy. 2, adjustments in the upper cervical allow the sinuses to drain properly. It helps the immune system work better, allows the body to cleanse itself better. That certainly will help greatly in the prevention or handling, caring for somebody that already has bronchitis. We want to use a saline wash. Those people that deal with a lot of allergy problems, we talked about that in one of the prior health kicks. A saline wash, like a salt water, they sell, for people that are real sensitive to that, they sell a mist. Works really well for those people, and what it does, just gives you a little cleansing of the sinuses and a little cleansing of the inside of the nasal passage, and allows you to wash that stuff out so you're not swallowing it down, and many times it drips in the lungs and certainly can lead to a lot of infections. Here's the other problems. A lot of us take antibiotics. We don't realize that 50% of the antibiotics actually produced in the world are given to our farm animals, so to cows, to beef, so we're getting in our milk, we're getting in our meat, they're giving it to chicken, they put it in the feed of a lot of these animals, certainly lamb, things that aren't grass-fed, certainly have a lot of antibiotics. If they're commercially grown animals, unfortunately they're filled with antibiotics, so we're ingesting a lot of antibiotics. That weakens the system. We're also treated with antibiotics improperly. 94+% of people with any type of infection, it's viral in nature, it's not bacterial. So we have this idea that's, laryngitis and pharyngitis and sinusitis and bronchitis. Oh my God, if it's yellow or green when you cough it up, that's some type of scientific method to determine whether it's bacterial, viral, and as a result, you got these people, they take an antibiotic, and the problem with that is the antibiotic kills all the good bacteria in your body, so it makes you more prone or more susceptible to secondary infection. So if you take an antibiotic, and most of the time your condition is viral, not bacterial, what happens is it kills all the bacteria, almost guarantees that you're going to get a bacterial infection, makes you prone to gastrointestinal influenza because you're killing all the healthy bugs, colitis because you're killing all the healthy bugs, makes you prone to yeast infections, makes you prone to skin reaction. In fact, the number one reason to go to the emergency room is a side effect of a prescription drug. Number one drug to have a side effect to is an antibiotic. So I could go on and on all day, but the reality is bronchitis can be serious, but certainly to be treated with antibiotic more often than not is the wrong approach. The best approach is care that involves improving what your body already has in store inside you in order to get well. If I had a sick plant, what would I do? I wouldn't give it an antibiotic, right? What would I do? I give it water, sunlight, nutrition. Well, my body has the same ability to heal as the plant, so what do I need to do to my body? I need to give it proper rest, I need to give it proper fluids, I need to give it proper nutrition. That nutrition will be in the form of food and neurology, making sure your spine's straight so all those healthy messages are going up and down in your immune system and lungs and cardiovascular system and so forth, are working the way they're supposed to. Those are really the best approaches. Now you talk about cold steam, you can talk about I say vaporizers, I apologize to say steam. You can use a hot steam or you can use a cold vapor. Those are actually all very good, and what that can do is that can get, you can put some herbs, homeopathic tinctures inside the liquid, and that can actually allow you to breathe better, and there's a lot of great homeopathic approaches to handling bronchial infections as well. Proper nutrition, make sure you're on a good multivitamin filled with antioxidants, extremely important, help out the immune system. And make sure you got minerals, make sure it's a multivitamin, multi-mineral with antioxidants. I'll tell you, there's a lot of great products out there that help you with that as well. So by doing that stuff regularly, you're less likely to get bronchitis. If you get the bronchitis, then like I said, I would do all of those approaches, and you'll be amazed at not only will you be able to come over that infection without using any types of drugs, but your immune system has now learned how to handle that better, whether it's an allergy, a viral, or bacterial infection. And then as a result, what will happen is you won't be so likely to get it the next time and the next time. And over a period of a year or so, your lung tends to heal, and then you just don't get bronchitis anymore. And that's the best approach, the healthiest approach for it. And if you follow some of that advice, if not all that advice, I think you'll be very, very pleased. So share this with friends and family and so forth. We've been getting so many emails from people all over the world. It's amazing, from England and Australia and Canada and Mexico and the United States and the different countries in Europe on these health kicks. So I really appreciate those of you that have watched these, pass them along to as many people as you can. I think many people find them helpful. For those of you guys that are local in the Syracuse or Central New York area, we'd love to have you part of our practice. We work with grandma and grandpa and mom and dad. We work with young children. We work with babies. And we really have a wonderful practice that's a family-oriented practice to try to get people well and then keep them well and get them on the right track. I think it's unfortunate in our society that we look at disease as in the expression of disease, these symptoms, as the problem, when in reality your body has everything that it needs in order to be healthy. And by working with a health practitioner like myself, you can allow the body to express that health like it should and allow the body to be healthy all the time, or almost all the time. And the quality of your life, the interaction with your friends and family, the interaction with coworkers, your energy level, everything's improved. The quality of your life is just improved at every level. And it amazes me how many people say that to me, and it's still amazing how many people don't really get it or don't fully understand that. So think about that, and hopefully someday you'll be part of our practice. And Monday is a perfect day. For those moms that are watching, or for those of you with moms, certainly say hi. For those of you that maybe mom's no longer with us, say a prayer and tell her hi, because she's certainly watching down on us. You guys have a wonderful day. Certainly stay healthy. Remember you, your mother, your father, your grandfather, your uncle, your cousin, your coworkers, everybody you know, you got to be under regular chiropractic care. You guys have a wonderful day. I'll talk to you guys next week.